Speaking of COVID and the holidays, should the new threat of Omicron affect your holiday plans?
Back from vacation and joining us today is UW Health's Chief Quality Officer, Dr. Jeff Pothof. Welcome back.
Welcome back. We both made it back.
We made it back.
Well, here we are again, another holiday season overshadowed by COVID. So what is your advice as people are, traveling for the holidays?
Yeah, I think there's a couple of things here. So if you're fully vaccinated and you're boosted, your likelihood of giving COVID-19, even Omicron variant, is lower. There could still be breakthrough cases. You may want to do a rapid test before that holiday gathering or right before travel just to make sure you're not asymptomatically carrying it. And if you're severely immunocompromised, you have risk if you were to get COVID-19, you might want to make that virtual. If you're unvaccinated, no, the risk right now is really high. We have a lot of COVID in the community. Omicron is coming fast. There's really not a safe way to gather if you're unvaccinated, especially if you're going to have a meal, take that mask off. That really needs to go virtual this year.
We reported at the top of the show, though, there's a scarcity of the rapid tests. They're hard to come by right now.
I know. I was talking to my wife, trying to figure out how to get our test before Christmas dinner, and apparently it is hard to get. It sounds like the Biden administration wants to make these available, but right now having them available would be pretty convenient versus later in January.
All right. When we look back to, last year, and it kind of feels like we're in the same place, a few differences, but what is the hope that people can have when we compare this year to last year?
Yeah, I mean, it does sound bad right now, and it's not great, but compared to last year, we have a lot more tools. We aren't having a shortage of supplies or anything like that. No one's particularly worried about ventilators right now, at least not here in Wisconsin. We have treatments that are more effective, monoclonal antibodies. We've some of these oral medications that we can use against COVID right now. And the big thing is vaccination. As much as we talk about the folks who haven't been vaccinated, there's over 200 million people in the country who are vaccinated. And even though they're more susceptible to breakthrough cases at this point, they're likely not to get that ill. They're not going to end up in the hospital dying of COVID at the same rate as unvaccinated folks are. So compared to before, we're in a better place.
Yeah, a year ago, the vaccine had just started.
Just started, yep.
And now it's a different story. I mean, the face of COVID, March 2020, is a lot different than it is right now.
Yeah, March 2020, we didn't know what we were dealing with. We didn't know how contagious it was, how sick would people get. We didn't have the equipment and the supplies we needed to effectively protect people. We were still learning what we needed to do to provide safe care, what kind of mitigation strategies need to be in. Early on, it was like mask or no mask. You probably remember those debates. We've come a long way since then.
A lot of the symptoms from from people who are vaccinated and boosted, very mild, resemble a cold. So how can you tell? Is there just, the surefire way to tell cold or COVID?
No way. In fact, you can't really tell early on the difference between COVID, influenza, or just a common cold. They would have similar symptoms. You'd really have to get a test to get that figured out. Just kind of guessing, it won't work. It could be any of those three.
A test is the only way to find out.
Test is the only way to know.
How are we doing in the hospital right now?
I wish I had good news for you, but hospitals are really full right now, and everyone's being creative about how to, create room and move staffing around. But I am a little bit worried. We have Christmas coming with a lot of travel. We have influenza that's starting to heat up, and we don't have very many more cards to play before we're in a bad spot for hospitals. So everyone needs to be careful. Hopefully folks can do what they need to do to stay safe and not get sick, because the state of healthcare here in Wisconsin and around the country, it's not looking good right now.
And most of the people getting hospitalized are unvaccinated.
Absolutely. It's hard for us to see this as healthcare workers because we see someone who can't breathe and we know it's preventable. And then it weighs on us that there could be other people who did get vaccinated, they did get boosted, but they still can't get in the hospital because there just are no beds. It's not just something that affects COVID folks who are unvaccinated.
Yeah, that seems to be a key takeaway. Not only are healthcare workers overwhelmed yet again, but other people who need other types of care are impacted as well.
Yeah, the circumstances really just aren't that great right now for healthcare. They're doing everything they can to take care of as many people as they can, but the deck's stacked against us.
And before COVID, thousands of people were hospitalized with the flu.
Yeah, that's what we're worried about. Last year, if you remember, we didn't really have a
100 cases, I think.
Yeah, and this year I've diagnosed a few myself already. I think we're going to see more cases. Hopefully not as many as what we saw in, say, like 2019 or so. But, usually there'd be a few thousand people hospitalized with influenza. That just adds on to an overwhelmed healthcare system right now.
Yeah. And then you touched on it earlier, but President Biden announcing plans to send out those tests to people. Do you think eliminating that price factor and giving better access access to those types of tests, will those make a difference?
I think those two things can help. I mean, the tests themselves aren't overly expensive, but they're hard to come by. So probably the biggest thing is just access. And then what I think you'd want to see is individuals saying, you know what, I'm going to do something, but let me just take this 5-minute test to just make sure I'm not positive. And if a lot of folks do that, folks that are unexpectedly positive, well, they'll stay home and we won't have as rapid a spread. So I do think it's a good idea to have more available testing that's easy and fast.
And get a shot for Christmas. How's that?
You know, a booster for Christmas would be a wonderful gift to
Wonderful
yourself.
gift. Well, have a Merry Christmas to you and your family.
Same to you.
We'll see you next week.
See you guys later.
Yeah, happy holidays.
Well,